Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This is a question we get quite often, Brad.
Yeah.
I'm kind of surprised, after all this time, that there's still a lot of questions about when you should use a cold pack versus a hot pack. And it's really important to know this.
It is, because it can make a difference between having your injury get worse or get better quick, one way or another.
There's some cases where it's not going to matter, and we're going to go talk about those too, but there's some cases where it really does matter.
Sure.
So,
yeah, like I said, this is a little controversial from therapist to therapist, doctor to doctor, chiropractor, etc. So we're going to set you straight.
Little sidebar. We've always got controversy, Brad. Okay, before we get any further, let's talk about the people that just came in to watch us here.
One of them's running back and forth.
Yeah, he is running back and forth. If you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, if you haven't joined us on Facebook, come on over and join the party. We're having fun. Just like us.
Yeah, like us, because we need to be liked.
We need to be liked.
We're starting to feel better now.
Yeah, we're starting to get through our psychological sessions here. So, all right, Brad, let's talk about maybe what we want to start with, like an acute injury.
Right. Where it's a hard. Pretty much everyone agrees on this. Say, for example, you slide in the first base, you sprain your ankle really bad, it's puffing up. I don't think there's anybody that's going to say put a hot pack on it.
Right. So an acute injury is a recent injury.
Right.
So
put a cold pack on it, elevate it, compress it, get it up in the air, get that swelling under control. And typically, the rule of thumb is 0 to 48 hours. From the time it happens, at least a couple of days before you would change from cold to hot. I personally go a little longer than that.
Sure.
But again, it depends on the individual, and this is the way me speaking to my patients, or circumstance.
Well, I think also, Brad, what people may not understand is, like, let's say you just injured your back.
Sure.
Yeah, there's swelling going on in that back too. You may not see it.
Right.
So with a recent back injury, I would do the same thing.
Exactly.
If you just hurt your back, I would go for the next 24 to 48 hours.
Right.
I would be using cold.
Sure.
And then after that, you can decide.
Right.
But so I don't, a hip injury, any type of injury, shoulder injury, if it's a recent injury, start with the cold.
Yeah, any part of the body. The one thing, if we take a sidestep into backs, I think the thing about back injuries is people oftentimes continually re-injure their back day after day after day just by sitting poorly. So there's always a certain amount of swelling and irritation to the back. So with backs in particular, I probably use cold packs more than heat.
Yeah,
but not always.
So it's almost a constant new injury.
Right.
I mean, so that's why the cold may feel better. I think cold does penetrate deeper too, doesn't it? I was always taught that.
Right.
And I haven't read up on that recently, so maybe you don't want to quote me on that, but I was, so.
Exactly. As far as things that you have to be careful about with cold, if you got a cold pack, look at this cold pack right here. It's frosty. It just came out of the freezer. Here, let's say I've injured my elbow. I'm not going to put this cold pack directly on my skin. This freezer could have been at 15 degrees. You pull something out at 15 degrees, put it directly on your skin, leave it there for 20 seconds. You pull it off, and you got frostbite on your skin.
I think also it's just like with heat and cold. If you're on a bony surface, there's less protective adipose and skin and layers, so it's going to freeze easier.
Exactly. So in that case, I usually just take a pillowcase because it works really well. You got a.
Oh, that's a good idea.
You got a bucket to throw it into. It's not going to fall through.
Because sometimes we just take a paper towel and put it down or something.
You need something to insulate it. Not a lot. If you put 2 or 3 towels, it's too much. But you need something. And same with heat. You can burn yourself with heat. I've had patients that put a electric hot pack on their back and then fell asleep with it.
I hate to say how many times. I mean, we've even had we do normally in the clinic setting, we check it after 5 minutes. We had one guy, we checked it after 5 minutes, it was fine, and then we kept asking him, is it fine? Yeah, it's fine. And he took it off, and it was a slight burn.
Yeah.
And he apologized. He goes, you kept asking me, and I said it was fine. So
Be careful.
You have to be careful with it. It's really easy to burn.
Right.
I mean,
These are things that there's no question on. And then probably the time, there's a little variability on this, but typically 15 to 20 minutes, whether you got a cold pack or a hot pack, is going to do the job that it's.
do you want to show a cold pack, Brad? Why don't we show maybe one way to use it for the back and maybe
Sure.
for an ankle?
Yep.
A lot of times what we want to do is, if possible, if there's an injury, you do like to get it elevated too, because the elevation is going to help with any edema or swelling that's developed. We're a big fan of this leg wedge.
Yep.
This is good for, actually would be good for an ankle injury and for a back injury.
Right. With the back, this doesn't elevate the back, but it does really put it in a relaxed position. So this is one of those situations where it doesn't elevate, but it really does a nice job. Lonnie, you want to throw a pillow there? Yeah, just give it a toss. Be careful, though. Don't hit Bob in the head. Yeah, that's good. Thank you.
Good arm there, Lonnie. Good arm.
So we're going to demonstrate. I'm going to put this cold pack on my low back. Bob's going to demonstrate
ankle.
how to take care of an ankle sprain. So we're getting two parts of the body at one time.
So again, he's elevated here. I can put the cold pack. A lot of times people, they sprain their ankle on the outside of the ankle, so we can put the cold pack right there, and then you can just take an ACE wrap, and you can go ahead and wrap around and put it in place. And this really feels good, doesn't it, Brad?
Oh yeah, I'm in heaven right now. I got a cold pack on my back. My ankle's getting chilled. Just remember not to go too tight with the compression.
Right. It doesn't need to be tight for this. I mean,
Right. A little snug is all, but if you get it too tight, you could actually cut the circulation off to your foot and cause a problem.
So, you know, and this reminds me, Brad, a lot of times, right, people after they hurt their back, have you seen it where they feel like they can't sleep in bed at night, and so they sleep in a recliner?
Sure.
And I always felt like some of the reason behind that is they're trying to almost elevate the back a little bit.
Oh,
you know what
yeah,
I mean?
Yep, it could be.
I don't understand it, because some of them, they literally cannot sleep in bed.
Yep,
I mean, they just can't. It keeps them awake, but they can sleep in a recliner.
Yep.
So, all right. You want me to take this off, Brad?
Yeah, I suppose. Take it off. We got work to do. People are still waiting for our other nice hints and tricks that we've learned over the last 30 years.
Now, another form of, well, I guess we never even get one of those. Sometimes for ice, you can just take a styrofoam cup, freeze the water in the cup, tear off the top of it, and then you can quickly ice something down.
Yeah, we got a video just last week we put up
Yeah.
that shows, and we demonstrate that very clearly how to do that. What about with heat?
What about it, Brad?
Same thing. Do you elevate? You don't have to elevate.
No,
with
you don't
heat.
have to elevate with heat.
You can go any comfortable position. You should be
Right.
relaxed position where you can relax. The thing with heat is it vasodilates, increases circulation, helps relax the muscle, which, you know, again, makes it feel good. So,
What I have found with heat, obviously, and anybody who has arthritis is going to understand this. If you have arthritis and you're having pain, generally heat's going to feel better.
Yeah.
I mean, a lot of them just don't like the cold. I mean,
although I do have a patient right now, she's got severe arthritis in her knees, and she loves the cold.
does she really?
Yeah, so again.
There's exception to every rule, but if I were to, you know, be a betting man in most kinds of arthritis, you're going to try
I
it.
would agree. For hot packs, therapists typically use a wet hot pack.
Yeah, a moist hot
Moist
pack.
heat, you can get a little more that heat conducting to the skin. They just work better, they feel better. You just gotta be careful because they don't feel warm at first.
Right.
But about 2 or 3 minutes in, they can heat up, and then you gotta use towels. And you may use 4 or 5 layers of towels to insulate it. We keep our hot packs at 160 degrees. That's pretty typical for a hydroculator, what we use. At home, if you use an electric one,
That's where you gotta be safe.
You need to be careful.
The more you lean on a hot pack, the less the heat is, you know, spread out through the body. I mean, it stops it. You know what I mean? Compression will
Right.
stop the blood from being distributed
Okay,
as well.
right, because
so
it's-
you'll burn faster is what I'm trying to say. If you're if you're leaning on a hot pack as opposed to having a hot pack on you, it's going to cause
So
more
if
likely to
you
cause
put
a
the
burn.
hot pack on a recliner and you lean,
lean
into
on it.
versus laying on your stomach and putting the hot
Right.
pack on your back.
It's gonna get hotter quicker.
Right.
So
Right. So you know, there's usually settings on most electric hot packs or the pads, and if you put it on high because you want it to heat up quick, and then you fall asleep, and that hot gets too hot, and then again we talked about the skin burning situation.
Right, and what I was taught, by the way, in Braden School, and this was 100 years ago, but one is that moist heat versus radiant heat, which is a lamp,
Right.
versus just regular heat like from a heating pad,
Yep.
they're all the same.
In what regards?
In how
How
they,
deep it goes into
penetrate,
through the skin.
which
yep.
they do not penetrate very deeply.
Right.
It's only a couple millimeters. Versus, which we're going to talk about a different option here, the radiant heat,
Right.
or the far infrared heat.
Infrared, right,
Yeah.
right. So should we get right in?
Yeah, why don't we get into that?
Because here we've got the normal hot pack, and again, heat lamps. You can use a heat
Yeah,
lamp.
you can use heat lamps.
It's not used in therapy like they used to be 20, 30 years
they were
ago.
real popular back then.
Yep.
So this is far infrared, and the advantage of this is that it penetrates much deeper. So where you normally have 4 or 5 millimeters, this can go up to 60 millimeter, which is we think is 2.36 inches.
It's
I think.
over 2 inches,
Yeah.
which is a much deeper, at least 5 times deeper than the
So
other.
yeah, imagine this versus this. I
Right.
mean, it just
You're
makes
getting into the muscle for
Right.
sure, or into the joint.
This is made by Thermatex. We'll put a link below.
And it is electric, so we talked about electric, be careful electric, but this is different because it's only one setting.
Right.
And they say you can be on it for 45 minutes, so naturally I didn't believe them, so I tried it, and I actually did fall asleep with it, and I woke up later in the evening about 11, it's been a couple hours.
They don't recommend it, but you can if it happens.
The point is that it didn't,
It's safe.
it was just a comfortable warmth.
Right.
It does not get that warm, but it does penetrate.
One of the representatives from the company actually talked about how during the winter, she lives up, I mean, they're from Calgary,
Yeah.
and she puts it on just as a heating device in her office. So she puts it in her chair so she
Right.
can lean against.
Right.
This got 3 hard panels. This is the platinum one. And the hard panel always goes to the body. That's how it helps direct the far infrared waves or rays or whatever they are. And you can actually strap this in place. It's got a long strap and a short strap. And what you can do is you can actually move around a little bit with this, Brad.
Yeah, you could get an extension
Yeah.
cord and you go dancing with it.
But it's got a long cord. It's got an 8-foot cord,
Yeah.
really good cord. So what's really nice about this, so
Right.
this is a really good option for if you really want to get some deep penetrating heat.
Right.
So,
Unfortunately, there's no options like that for
right.
go lay in a snowbank, but we don't recommend that.
What another reason where we might use cold? It seems like, Brad, that it does reduce nerve conduction, right?
Right. And which relaxes the nerve, and actually you can get a muscle to relax with cold. And
Right.
there's been studies done on this, and I actually went to an in-service by a gentleman who led one of these studies. Although it's not really widely spread done. He did it with a lot of MS patients.
Oh, sure.
Really tight muscles, and he put cold pack versus heat. So once again, you got this flip-flop.
So we're even talking about if you have muscles that are spasming,
Right.
or if you have spastic muscles,
Yep.
is what you're saying.
Right.
This actually may calm things down.
Exactly.
So, and I've seen that where, again, a lot of times muscles spasm right after back pain.
Sure.
And that's why a lot of times I like
Right.
the cold too.
So now we've got them thoroughly confused on.
Right.
But again, going back when we talked about the first 48 hours of an injury, that's when things are pretty black and white.
Right.
After that,
You can also mix them up, by the way. You can do heat and then cold.
A contrast
yeah,
bath.
contrast bath.
which we do have a video on
We
that
do
as
have a
well.
video. We should probably redo that one too.
Yeah.
Just a general rule of thumb. Generally, you kind of go 5 minutes in the hot, 1 minute in the cold,
Right.
5 minutes in the hot, 1 minute in the cold.
And typically, the last one would be the cold.
Right. So, all right.
Wow,
Wow,
Bob, I'm getting all confused.
All right. Thanks everybody for sticking with us.